By the end of the day, shoes that felt comfortable in the morning may start to feel tight, socks may leave deep marks around the ankles, and the feet may look puffier than usual, raising the quiet question of whether this is simply part of getting older or something that should not be ignored. What many people are never clearly told is that leg swelling after 60 is not something to dismiss, and it is not always something that requires medication. In many cases, the body is responding to daily habits, circulation patterns, and gravity itself. In this video, you will learn 3 simple daily habits that are often overlooked but can help improve blood circulation naturally, reduce swollen feet and ankles, and restore a lighter, more comfortable feeling in the legs. You will also learn how to recognize when swelling is relatively harmless and when it may be your body signaling that something more serious needs attention. If your legs often feel heavy, tight, or uncomfortable by the evening, this information can help you understand what is happening and what you can begin doing differently starting today. This information is educational and meant to help you understand what may be happening in your body and what you can safely observe or adjust at home. It does not replace medical care or attempt to diagnose conditions. Think of it as practical guidance based on common patterns seen in people dealing with leg swelling after 60, especially when poor circulation in legs begins to show up in everyday life. What often feels confusing is how swelling seems to appear or worsen with age. One day everything feels normal, and by late afternoon the ankles feel tight, socks leave deeper marks, and the feet look more swollen than before. This is not imagination or a vague side effect of aging. Swelling happens when fluid collects in the lower legs instead of returning efficiently to the heart, and gravity plays a constant role. Over time, vein valves may weaken and allow blood to drift backward, which helps explain why chronic venous insufficiency and other leg edema causes become more common and lead to swollen feet and ankles later in the day. Reduced movement adds to this effect. The calf muscles act as a natural pump that helps move blood upward, but long periods of sitting, standing still, or low daily activity weaken that pump. Diet, medications, and sodium intake can quietly increase fluid retention as well. Swelling patterns matter here. Sudden swelling, one-sided swelling, or swelling with pain, redness, chest discomfort, or shortness of breath needs immediate medical attention. Gradual swelling in both legs that worsens during the day and improves overnight often responds well to natural remedies for leg swelling and leg swelling home treatment strategies. Circulation responds to signals, and the most important signal the legs recognize is movement, which leads directly into the first habit to focus on next. Habit number 1, the calf pump routine, movement that pushes fluid up. When dealing with leg swelling after 60, this habit is foundational because it works with the body's natural design for moving fluid upward against gravity. There is no need for supplements, special equipment, or intense routines. What matters is regularly activating the calf muscles, which act as a powerful pump that helps push blood and fluid back toward the heart. When this pump stays active, swollen feet and ankles tend to ease. When it remains inactive for long periods, fluid accumulates, ankles swell, and the legs feel heavy by the end of the day. Poor circulation in legs is often mistaken as unavoidable with age or something that requires strenuous exercise to improve, but what truly makes the difference is frequency, not intensity. Long periods of sitting or standing still, whether while watching television, driving, reading, or working at a desk, allow the calf pump to shut down. As a result, fluid pools, sock marks deepen, and ankle swelling in the elderly becomes more noticeable. The encouraging reality is that the calf pump responds quickly to gentle, repeated movement. Circulation improves when movement happens in small, regular intervals rather than in one large effort. Calf pump exercise works much like traffic flow. Short, frequent movement prevents congestion, while long periods of stillness allow buildup. Research involving chronic venous insufficiency shows that simple, targeted movement improves calf pump function, muscle strength, and ankle mobility, directly influencing common leg edema causes. One of the easiest ways to activate this system is by interrupting sitting time with brief movement. Each hour, about 30 seconds of calf motion is enough to send a strong signal. Sitting upright, lifting the toes toward the shins and then pointing them downward, or lifting the heels while keeping the toes on the floor, gently squeezes the veins and helps fluid move upward. Repeating this throughout the day creates a meaningful cumulative effect. Walking also plays an important role, especially when spread across the day. Short walks after meals help keep the calf pump active and support leg swelling home treatment without feeling overwhelming. Even a few minutes at a time is effective when done consistently. Strengthening the calves adds further support. Simple calf raises performed at a counter or chair, rising onto the toes and lowering slowly, help maintain muscle function that improves blood circulation naturally. A small amount of ankle mobility work, such as gentle circles or tracing the alphabet with the foot, helps ensure the pump works efficiently. With regular practice, changes appear gradually. Legs often feel lighter, sock marks become less noticeable, and standing feels more comfortable by the end of the day. These signs indicate that circulation is responding, setting the stage for the next habit, which works alongside movement by using gravity more effectively rather than fighting it. Habit number 2. Elevation breaks that actually work. After movement is addressed, elevation becomes one of the simplest ways to reduce leg swelling after 60, not by adding effort, but by using gravity more intelligently. Many people believe they are already elevating their legs, yet the way it is often done does not fully support circulation. Partial elevation may feel comfortable, but proper elevation changes how fluid moves through the legs. Throughout the day, gravity naturally pulls fluid downward, especially during long periods of sitting or standing. By late afternoon, swollen feet and ankles are often the result of this constant downward pressure rather than a sudden problem. Elevation works because it temporarily reverses that pressure, giving veins relief and allowing fluid to move back toward the heart with less resistance. For individuals dealing with poor circulation in legs or chronic venous insufficiency, this shift can noticeably reduce discomfort. The most common mistake is elevating the feet on a low stool or footrest. While this may feel relaxing, it often does not raise the legs enough to counteract gravity. Effective elevation requires lying down and placing pillows under the calves and ankles so the feet are clearly higher than the hips and closer to heart level. The goal is not to create an extreme position, but to ensure fluid is encouraged to move upward rather than remain pooled in the lower legs. Spending 15 to 20 minutes in this position once or twice a day, particularly in the late afternoon or early evening, can make a noticeable difference. Some people prefer shorter sessions spread throughout the day, which can be just as effective. The key factor is consistency, because elevation works by undoing the effects of hours spent upright rather than producing instant results. Elevation becomes even more effective when combined with gentle movement. While the legs are raised, performing slow ankle pumps for short intervals further supports fluid movement by activating the calf pump without strain. This combination of gravity relief and muscle activation offers a practical way to support leg swelling home treatment and reduce daily discomfort. Many people begin to notice improvements within the first week, especially if swelling tends to worsen toward the end of the day. Others experience a more gradual change, which is equally normal. Elevation works best when it becomes part of a routine rather than a reaction to discomfort, helping prevent heaviness from building instead of waiting for it to appear. Even with movement and elevation working together, daily habits related to fluid balance can either support or undermine progress. Small, often unnoticed choices influence how much fluid the body retains, which is why the next habit focuses on adjusting those triggers in a practical, manageable way. Habit number 3. A fluid-smart daily routine, reducing the triggers that make swelling worse. When movement and elevation become consistent, it is natural to expect leg swelling after 60 to resolve completely. Sometimes it does, but often there is still a missing factor. That factor is not about adding more effort, but about removing everyday signals that encourage the body to retain fluid. A fluid-smart daily routine works by reducing those signals and allowing circulation to function with less resistance. One of the most common triggers is sodium. Salt encourages water retention, and while it does not need to be eliminated entirely, many people dealing with ankle swelling in the elderly consume far more than they realize. Most sodium comes not from the salt shaker, but from packaged foods, deli meats, canned soups, frozen meals, sauces, snacks, and restaurant meals. Even a diet that feels normal can quietly promote fluid retention. Awareness is often more effective than strict restriction. Reducing obvious high-sodium foods for a short period and observing changes can be revealing. Sock marks may appear lighter, swollen feet and ankles may feel less tight in the evening, and morning puffiness may decrease. The goal is not perfection, but recognizing patterns and uncovering hidden leg edema causes without stress. Hydration also plays a key role and is frequently misunderstood. Drinking too little water can worsen swelling because the body responds by holding onto fluid defensively. At the same time, heavy fluid intake late in the day can increase discomfort. A steadier pattern works best, with most fluids consumed earlier in the day and a gradual reduction toward evening. For most adults, this supports balance and helps improve blood circulation naturally, while those with heart or kidney conditions should follow individualized medical guidance. Protein intake adds another layer of support. Adequate protein helps keep fluid inside blood vessels, rather than allowing it to leak into surrounding tissues. When nutrition is poor, or after illness or unintended weight loss, swelling can worsen. Awareness is enough here. If swelling increases alongside fatigue, low appetite, or unexplained weight changes, that combination deserves medical discussion. Compression can also be helpful when used appropriately. It is not medication and does not indicate failure, but a mechanical support that helps veins move fluid more efficiently, especially in cases of chronic venous insufficiency. Even low-pressure compression can reduce swelling when worn in the morning before fluid accumulates. Sleeping in compression is rarely necessary unless advised, and guidance is important for those with circulation disorders. Used thoughtfully, compression complements natural remedies for leg swelling rather than replacing them. This habit is effective because it removes resistance instead of forcing change. By aligning daily choices with how circulation naturally works, the body begins to respond more predictably. As these adjustments become routine, swelling patterns become clearer, making it easier to understand what the body is signaling and how to respond moving forward. When movement, elevation, and fluid-smart habits are in place, leg swelling after 60 starts to make more sense instead of feeling random. Clear patterns begin to show, and recognizing them becomes one of the most useful tools for understanding circulation health. It is often like finally recognizing a language the body has been using quietly for years. One of the most important details to notice is whether swelling affects one leg or both. Swelling that appears mainly in one leg, especially when it is new, deserves closer attention. Swelling in both legs more often points to broader influences such as gravity, daily habits, medications, poor circulation in legs, or chronic venous insufficiency. This single observation can prevent unnecessary worry or signal when further evaluation is needed. Timing also provides valuable insight. Swelling that appears suddenly tends to require prompt attention, while swelling that develops slowly over time usually aligns with longer-term leg edema causes such as reduced movement, changes in vein function, or diet. Knowing whether swelling is sudden or gradual helps guide a more appropriate response. Overnight changes are often the clearest indicator. When swelling improves by morning and worsens during the day, gravity is usually the main factor. This is the classic pattern seen with swollen feet and ankles related to circulation and is the pattern that responds best to calf pump exercise, elevation, and leg swelling home treatment strategies. Improvement overnight suggests fluid movement is the issue rather than fluid overload. Skin changes offer additional clues. Discoloration around the ankles, dry or itchy skin, thickening, or visible varicose veins usually develop slowly and reflect long-standing circulation challenges. These signs are not cause for alarm but reminders that circulation benefits from ongoing support. What makes this checklist valuable is the sense of control it creates. Observation replaces guesswork, understanding replaces anxiety, and habits begin to feel more personal and effective because they respond to what the body is actually communicating. Everything shared here becomes meaningful only when it turns into action. Circulation improves through consistent habits, not through information alone. The encouraging part is that progress does not require perfection, expensive treatments, or extreme changes. It begins with awareness and continues through small daily choices that add up over time. Consider which habit feels easiest to begin with. Regular calf movement instead of long periods of stillness, intentional leg elevation instead of waiting for discomfort, or paying attention to daily triggers that cause fluid retention can each support circulation in a practical way. These changes are not about forcing the body, but cooperating with it so it can work more comfortably and efficiently. Sharing experiences can reinforce that progress is possible. Noticing whether heaviness, tight socks, ankle swelling, or evening discomfort feels most familiar helps build awareness and connection with others dealing with similar challenges. If this video provided clarity or practical value, supporting it helps more people find the same guidance. Liking the video, sharing it with someone who has mentioned leg discomfort, and subscribing with notifications turned on helps keep clear, practical health content available for those who want to age with strength and confidence. Another video is waiting on the screen, continuing the conversation about everyday habits that protect circulation and overall health. Watching it is a natural next step toward applying what you have learned and moving forward with greater understanding and ease.